Hi everyone, we are Group 27. Today we would like to present you the healthcare delivery system between Taiwan, United States, and Germany. In our presentation, we'll start from Taiwan healthcare delivery system. The presentation will present by Walter and Marius from Martin Luther University.
And I want to start with the Taiwanese National Health Insurance. The NHI was established in 1995. It's government administered and takes about 6.2% of their GDP every year, where the revenue needed for the NHI coming from the employees, the employers, and the government itself. The NHI uses a classification which divides the citizens of Taiwan into 6 main groups containing 15 subcategories which are based on their job and income. Every citizen of Taiwan has an NHI card which is used to identify the person who had the card, store a brief medical history, and to bill the national insurer. So here you can see the NHI, which is administered by the Department of Health, and then some smaller departments, for example, the Bureau of National Health Insurance, the Bureau of Medical Affairs, which controls medical centers, hospitals, and GP surgeries, and several other bureaus. The financial structure of the NHI is structured that way that every citizen has a different amount of money. They get paid ranging from 100% of low-income citizens to 0% from self-employed people get supported. The fees are mainly fees for service, but there are certain diagnoses which use case payment, and chronic psychiatric problems and community services are paid per diem. Additionally, the NHI uses DRG since 2010. Application, there's an additional co-payment ranging from 10 to 30% of the whole expenditure in hospitals and medical centers to £1 to about £6 in GP clinics. There's one exception, which is cancer screening programs and annual physical checkups for people older than 65, which is to increase the uptake rates of those programs, which is completely paid by the disease control department. So you can see the the financial structure of the NHI, where the Taiwanese citizens pay premiums to the Bureau of the NHI and therefore get their NHI cards and pay co-payments to the hospitals to gain the healthcare services, whereas the hospitals and physicians make medical claims to the Bureau and get paid from it. The strengths of the systems are, it has a high approval rate in the country, and citizens can see any doctor without a referral. For example, they can go to any level of hospital directly. Additionally, it's a comprehensive coverage, so it covers almost all services from dental care to parturition, and also from Western medicine to traditional Chinese medicine. The NHI normally has short waiting times as providers claim and compete for the payments from the NHI. There's normally no waiting list even for short surgical elective procedures. The NHI is quite cost efficient as their administrative costs are under 2% of the total spending, and the Department of National Health negotiates with physicians and hospitals setting a global budget. Additionally, every procedure is looked on by a specialist panel, and procedures considered inappropriate are not paid. One of the other strengths of the NHI that is has a high coverage rate, so as it's mandatory for all citizens, there's a coverage rate over 99%. The last big strength of the NHI is that it provides a nationwide research data bank, as all claims and administrative data is kept in the Department of Health, and National Health Research Institutes also have a database for research purposes. Every good system also got some weaknesses, so one of the big weaknesses of the NHI is that the quality of the outpatient visits isn't very high, as there is a high level of health-seeking behavior, and every Taiwanese citizen has an average of 14 times per year they go to a doctor. Due to that, patients normally get about 5 minutes of physician time, which leads to a poor patient-physician rapport and the inability to deal with complex problems in one visit, which leads to even higher patient volume and higher medical costs. Having a weak referral system on the one side is a good thing, on the other side is bad, as there's a weak gatekeeping role of family doctors in Taiwan, and large institutions are always at full capacity. The solution to that, which is worked on, are discounts on the co-payments for referrals. Speaking about financial stuff, there are also some financial problems, as the money from the premium payments aren't always covering the entire healthcare system, so the government often provides additional funds. Additionally, changing the financial system is quite complicated, as every premium increase needs approval of the parliament. So now we can move on to, here are my sources, to the healthcare systems of Taiwan and the US.
In the USA healthcare system will presented by me, Han-Xian Huang, from National Taiwan University. For the US healthcare system, our online will be start from the background and finish in how it paid. USA healthcare system have mainly two different kind of structure. First is the government health programs, and the second is the private health coverage. For the government health programs, it has Medicare or Medicaid, and others like children's healthcare programs named as CHIPS, CHIPS, or the military health programs. And for private health coverage, the Blue Cross and the Blue Shield are the most well-known. And then let's turn back to the structure. The structure of the United States care program is health insured pay the bill by their risk according to the age or even the financial state. And there are multi-insurer from the government to the private insurer. However, there is different kind of payment standard according to different states or different hospital. So for example, the same illness or disease, if you visit different kind of hospital, you will have to pay different kind of bills. And later we talk about the organization that organize healthcare system. For the government health programs, it's organized by the Center for Medicare and Medicaid Service. By the way, the private programs organized by different kind of insurance company, and who can use it. We take the Medicare, for example, is for those who over 65 years old or under 65 years old and disabled, or those patients with ESRD, means end-stage renal disease. And let's talk about the percent that the healthcare program covered. The government insurance is covered at 37% of their citizens, and all the private plans cover 67%. However, there is still 8.8% of people that is uninsured. And financial for Medicare Part A is hospitalized insurance is $422 each month in 2018, and it will rise in 2019. For Medicare Part A means it covers hospital and facility care. For Part B, it's called medical insurance. It covers something like screening for cardiovascular disease and some prevention care. It's paid by per procedure. Each procedure you have each field, and it's my source. Next, we are going to present you the Germany healthcare delivery system. It's presented by Mike Xiong, Columbia University.
So Germany's healthcare system, give a brief background information and then go into more depths on some of the funding, services, and players that are involved in Germany's healthcare. So a little background about Germany's healthcare system. It's a universal multiplayer healthcare system, meaning that it covers every legal resident in the country, and there's different payers in the system. So the healthcare system is divided into two major groups. There's the public health insurance, and there's also the private health insurance. For their public health insurance, it's called the sickness funds, and I'll go into a little bit more in depth about the two options that Germany residents can choose from in the next couple of slides. So for Germany public health insurance, it's categorized as competing, and they don't attempt to earn profit from their business model, and it's also a third-party entity. There are around 130 choices that Germany residents can choose from in picking their public health insurance options. Health insurance. So for private health insurance, it can substitute public health insurance, and it offers a wide range of services and premium payment options that sometimes aren't covered in the public health insurance. And it's very attractive for usually young adults who have high-paying jobs so that they can get more services, but also negotiate for a lower premium since they're generally more healthier than the older population. And in addition, the civil servants of Germany, people who work for the government, are usually on the private health insurance plans as opposed to the public health insurance. And so a little bit about the services and oversight for the health insurance. So both the public and private entities health insurance in Germany have their oversight seen by the Federal Joint Committee, which is a part of the German government, which sets the payment regulations and what kind of services they're allowed to provide and cover, and for both public and private health insurance companies. And some of these services include preventative inpatient, outpatient hospital services and stays, dental care, mental health services, optometry, eye care, physical therapy. All prescribed drugs are covered as long as they're not just quality of life improvement drugs. Rehabilitation services, both public and private health insurance that specifically cover for long-term care and social support, both public and private health insurance that specifically cover for long-term care and social support, things like home visits for chronic illnesses, things of that nature, and also physician services. So essentially, German residents are able to see a doctor whenever they like and for whatever they like. As I mentioned earlier, Germany's healthcare system is universal, meaning that they cover all legal residents. And so for public health insurance, they are mandated to cover every individual who's legally there. And in addition, those who are not working but are dependents for the payer, they're also covered free of charge. So people such as children are also covered. And so how Germany funds both these public and private health insurance. So for on the public end, the sickness fund, as they call it, is funded through income tax from those who are working, and so begin to fund these public services, public health insurance funds. And so for the private There's also, it's usually funded through payment options such as contracts that the seeker is willing to pay based on how much coverage they want. And sometimes it's also covered by a portion covered by their employer that covers part of the premium payments, and then they have to pay the rest. In addition, there can be out-of-pocket payments by individuals who are seeking to get services that are not covered by the public health insurance, so such as like your own room in a hospital and more luxury items for healthcare services. And so payment for the players in the healthcare system, one of the big players are physicians, and they have their payments, their payments are usually capped to a certain level, how much they are being paid. They also operate still under a fee for service model payment, but the amount that they get paid for each service is negotiated between the doctors themselves and insurance groups on basically how much they're going to be paid for doing what. And in addition, physicians who work in hospitals are usually paid by salary, and hospitals themselves are paid on a per admissions standard. And so they range from public who don't, or private who are not for profit, to private who are for profit. That's it.
Thank you for listening. That is the end of our presentation.